Hi, What the Health Tech listeners. I'm your host this week, Justine Abson. This is the podcast where we tackle some of the trending topics, ideas and best practice in health and social care. This week, we're speaking to Jasmeet Rai, Associate Director at RCH Care Homes. Jasmeet has been with RCH for 4.5 years, and prior to this, she worked in accountancy and audits. Outside of work, Jasmeet enjoys spending time with friends and family, being outdoors, and loves the West End. Oh, I don't blame you there, Jasmeet. I absolutely love a good musical.
They're amazing.
They are, aren't they? It doesn't matter what you go and see. She's also passionate about improving EDI, greener policies, and femtech, which is where technology can help improve women's health and well-being. Jasmeet, welcome to What the Health Tech. It's great to have you here today.
Thank you so much for having me. It's such an honour and a privilege. Really appreciate it.
Brilliant. Well, we're going to discuss today about how social care innovators are driving positive change for people in social care. So Jasmeet, could you give our listeners a bit of an overview of this to start off with and the Institute of Health and Social Care Management?
Yeah, of course. So the Institute of Health and Social Care Management, it's been around for 120 years, but up until about 18 months ago, 2 years ago, their predominant focus was just on the healthcare side of things. And so internally, they made a decision that they also wanted to incorporate social care. I'll be honest, I hadn't heard of them 18 months ago. The first time I heard about them was when Jane Brightman put up a post on LinkedIn saying, who is involved in social care and wants to create change and wants to work with innovative ideas. I was like, oh, that sounds interesting. Let's go see what's going on and join. And it's flown from there. And it's really lovely because it's turned into this really beautiful collaborative community, which has, it's got different subgroups that focus on different areas. It's completely free, it's voluntary. You can come and join as many sessions as you want or as few sessions as you want. And it's, we've got subgroups which are focusing on the people plan for social care, which I know we want to talk about later, digital and tech and social care, workforce wellbeing, greener care, etc. So there's lots of little different areas that wherever someone's interested, they can just come and contribute or hear great ideas and implement them in their respective organisations.
Yeah, and I think that's it, isn't it? There's so much to talk about. I think something like this is absolutely brilliant. So how did you come up with sort of the Social Care Innovators Committee and what exactly is involved in that?
So it started off with the first meeting was very much a case of right, what does everyone want to do? What are we trying to achieve? And the key theme that came out of it was that it really wanted to be focused on creating positive change and action. So we know there's a lot of groups out there which are, when I say support focused, it's more a case of you've got someone where you can talk to about the issues that you're having, but there's not much that you yourselves can do about them. Whereas we wanted to create a group or a forum, I guess, where people have such great ideas, because one of the issues with social care is that it's so fragmented, and we wanted to bring people together so that they could then bounce off each other, realise that there's actually other people working probably similar ideas and try and make change happen, really.
I think that's it as well, and everybody learns from everybody else, don't they? It's everybody's in the same kind of position, but everybody does things differently. Yeah. So I think actually having that network and that group where everybody can learn from everybody is got to be a positive thing.
Exactly, and I've definitely learned so much, and I know other people in the innovators have as well. What's really great though is that if someone has an idea and says, there's a subgroup that I want to create or that I want to focus on a particular area, and that hasn't happened yet, they're definitely able to do so. I mean, one of the ones we've kind of created a semi task and finish group rather than a full group, which it sits within the workforce wellbeing one, and that's talking about trying to create support for employers within social care so that they can provide better support to their employees and workforce who are either current or historic victims of domestic abuse. We don't think there's enough support out there right now. We want to try and see what we can do to make it so that it's employer focused, so that we are able to support a wider group of people eventually. And that's one of the ones that we've started up recently, and hopefully it will make some change happen.
I'm sure it will. I mean, it definitely sounds like an amazing group to be part of and something that can make a real difference, which is fantastic. Yeah. So who makes up the People Plan Committee and what role do you play in that?
So the People Plan Committee, so like I said, there's various subgroups. The People Plan is one of those subgroups, and the co-chairs are myself, Palmi Dodia, who is a founder and director of Serene Care, Joan Bothmer, who is the head of care at Care Point Services, and then Adam Pennell, who is the director of social care at the Institute of Health and Social Care Management. So between the four of us, we organise like a lot of the logistical stuff, but the actual committee is made up of anyone and everyone who wants to contribute. So we've had people who've been with us from the very beginning a year ago. We've also had people who've joined us recently as 2-3 months ago once they found out about the people plan and they wanted to get involved. So we are very much a case of the more the merrier situation.
I think it has to be though, doesn't it? It's, like you said, some people are going to find out about you straight away, other people are going to find out about you later on down the line, and everybody's got something that they can contribute. So regardless of obviously when they're joining, it's great that people can kind of still get involved.
100%. When we started the people plan group, we decided that we wanted to create a people plan for social care, and there's so many people who complain about how social care has got so many issues and how it needs a people plan, and they've been waiting for the government to provide one for 10, 20, 30 years. We're like, well, why don't we create one ourselves? It's going to be the first one which is by the sector for the sector, and from there hopefully we can inspire other people to collaborate with us, to contribute and or create their own, depending on how they want to do it. We just wanted it to be a collaborative approach, really. We wanted it to be co-produced by the people who work in social care, by the people who use social care, people who advocate for those who draw on care. We wanted to represent the voices that aren't often heard. 80% of the sector is made up of SMEs. When you hear about social care in the news, you're often hearing about the biggest players in the market, but the vast majority of organisations, they're very, very small. And then obviously you've got other aspects within social care where you've got personal assistants or unpaid, friends and family who are providing unpaid care. And we wanted it to be something which could be supportive for everyone and like a positive force of change for everyone.
Yeah, and I guess, who better to write a report and this kind of plan than the people actually working it day to day. They're seeing it day to day. They're there and see the issues. They see the challenges. They see the positives. They see the negatives. So yeah, absolutely. I think having that those people involved in it is absolutely key.
Yeah, exactly. We're definitely firm believers of the fact that we feel a lot of the answers are already known by people who are in the sector. And by that, I mean, again, people who either work in it, draw on care, advocate for it, have a passion for social care. They often already have the answers. It's just a case of trying to bring them all together so that they can either work on them together or alternatively to build a platform so that they can share those ideas to a wider audience.
So obviously, we've mentioned the plan. It was first published in December 2021. And as part of this, there was a consultation process. So when did you launch this to the public and how was that consultation process done?
So we created the People Plan group in August last year. So we're on our 1-year anniversary. And we asked the question, we were like, all right, we want to create the People Plan. So initially we thought we would do it so that it would be launched in about a year's time, and then in a follow-up meeting we're like, you know what, actually right now feels like it's the best time to do it. And when we say right now, there is obviously social care was in the news a lot. If you think back to where we were in September to November of 2021, it was in the news a lot. COVID was obviously still making major headlines, and we felt that we had momentum on our side to try and get more people from the wider public who don't normally know much about social care or don't normally engage with social care to care about social care. Yeah. So we did a 3-month consultation which ran from September to November 2021. It fell into 2 parts. One part was a desktop review of the existing reports about social care that were already out there, there's no point reinventing the wheel. Let's take the information that's already out there, put it all together into one document. And then the other part was trying to get as many voices from the sector involved as possible. So there was a 3-month survey that went out. We also had people sending us messages on social media, voice notes. We did a couple of clubhouse sessions. So there's a health and social care clubhouse. It was mentioned on the Caring View. We pushed it out to various other organisations and asked them to share with their networks. So like NACAS, NCF, the Outstanding Managers Network on Facebook. We just tried to literally get it out to as many people as we possibly could. And then after that, we pulled together all of the information that was coming through. And the way that we had structured the report is, prior to that, there seemed to be 5 main areas that everyone in the sector was talking about, complaining about, feeling that they needed to be addressed as the most urgent. And those were the public image of social care, recruitment, retention and wellbeing, training, and pay, benefits, and the conditions of work. So we felt like, let's focus on those. And then as all the recommendations came through, one of the things that we really wanted to focus on when we created the People Plan report is that, number one, we wanted it to be something that was positive. There's enough media about the negatives in social care and not enough about all of the great things happening in social care. And we wanted it to be something which was supportive to the social care community. So where you have so many small providers or individuals, they are often struggling, not knowing that there's other support out there. And we wanted to create something where they could see from their peers, this is something that's tried, this is something that's worked, and this is the things that have worked for us, and we feel that you in a similar position, it would hopefully work for you as well. So that was this. So we asked about the current status quo of those 5 issues, what were their examples of good and outstanding practice, and then what were their recommendations for change in the future. And then those recommendations were then further split into short-term, medium-term, and long-term, which were then also split into those for government, those for providers, and then those for the media to action. And some of the recommendations require additional funding, but some of them are low-cost, high-impact ideas, and like you said, it's the answers are already there in the sector. We're just trying to give them a bigger platform.
Yeah, and I think pulling it all together in one place as well. I was going to say earlier, it's pulling all that information and getting it all into one report, and everything else must have been a challenge in itself, especially, kind of getting everybody involved from all the different sort of mediums that you mentioned and all the different areas. But yeah, I think having everything in that one place.
Yeah, exactly. I mean, we definitely had quite a few, I don't know if sleepless nights is the right word, but a lot of staying up until like midnight or 2 a.m. trying to put it all together, because the Care Innovators, it's a voluntary group. So this isn't our actual job. We all have actual jobs that we do, for like the entire week. And this is something that we created in our, I want to say free time, but does anyone in social care actually have any free time?
Yeah, but do you know what though? The thing that does come across in all the podcasts we do is, within health and social care across everything, is the passion people have to really make a difference. And it still surprises me every time I speak to somebody in terms of how much people do want to make a difference. People are invested into it. It's like you said, it's not just a job. I think we had Craig Rainford on a few weeks ago on the podcast, who had spent 20 years with 4 Seasons, and I think he had a quote about it's not just a job, it's a vocation. And 100%. You just see that more and more the more you talk to people. So I think hearing about this in terms of putting all of that effort into something that could really make a difference in your, like you said, not quite free time, but that's what it is a testament to kind of how much people do want to kind of change things.
Yeah, and I think that's what we were definitely, I don't know if surprised is the right word, but we were definitely really pleased by when we saw the results coming through from the survey, from the consultation, the feedback on, like Clubhouse, social media, etc. It's that so many people cared. They just hadn't had anywhere where they could be before, or if they had tried, they hadn't felt like it'd been effective enough. And obviously we had no idea the momentum that the People Plan would end up generating, which we're obviously really pleased about, because we wanted to create something that's really positive and supportive for the community. But when we first created it, what we wanted it to be is something that was, it's not just a report that you create and then you put on a shelf and never look at again. We wanted it to be the start of a movement and momentum. So we've got another report coming out this year where we take the feedback suggestions from last year, talk about some of those same topics to see what recommendations have been put in place, but also additional topics, additional ideas, there's always innovation happening. And it sounds cheesy to say it, but we definitely feel like that the social care sector as a the entirety is definitely how do I explain this? It's very true when you say they are the change that they want to see.
Yeah, I think, like you said, you don't want it to be we've done a report, it goes on the shelf, that's the end of it. And I think a lot of things can be like that. But yeah, to kind of have that movement of you're already, working on the 2022 version sort of thing at the moment, and I'm sure we'll chat a little bit about that. But yeah, I think that's really important, because things do change constantly. I mean, look at the last sort of few years and, nobody could have predicted that. So there's always something, I think, that comes up and I think the really lovely thing is the positive side of it. It's about making change positively. And there's so much positive stuff that happens in social care. But like you said, there's so much focus on the negative side that it doesn't always come across that way. So I think for a report to have been written that can make a difference, that is positive, is brilliant.
Yeah, that's what we wanted. And we wanted it to be something that it helped create a community. So we've had individuals, like both individual providers and actual individual people who either work in care or go on care, and they've come back and said that they felt that they were the ones who were, they felt they were doing everything wrong. And then suddenly this report came out and they realized actually everyone is in the same boat. Everyone is struggling through those same issues. And some of the recommendations that they can put in place are ones which are cost effective, high impact, and it's been valuable to them. So we've had providers who've come back to us and said, we've implemented one of your recommendations from recruitment or from the public image, and we've seen that there's already a difference starting to occur. And obviously the more people within social care who get involved, hopefully more and more change will occur over time. It's not a quick fix overnight, but it's definitely a step in the right direction.
Yeah, which is always the best place to be, even if it's baby steps. It's as long as you're going in the right direction, then it's a great thing. We've obviously talked about the results and things like that a little bit. So they were reviewed and published in December, and you obviously played a bit of a key part in this process. So can you tell our listeners a little bit more about that? I know it was launched at the House of Lords, so I'm sure that's a really interesting point that our listeners would like to hear about.
Yeah, so we published in December because honest reason is that we know that with Christmas coming up, everyone's going to get very busy with that, both from a work perspective, but also from a friends and family perspective. So we wanted to get it out early enough that people would have time to read, absorb, and then if they wanted to start incorporating some of those changes in the next couple of months, hopefully it would be useful to them. So we did that and we tried to share it with as many networks as we could over the next few months. And then we launched it at the House of Lords in March 2022, which was an amazing experience. So thank you to Baroness. So it was meant to be Lord Hunt who was going to do that, but unfortunately he ended up not being available on the day, I think, of COVID. So thankfully Baroness Wheeler jumped in instead. And she officially launched it. So from there, what's happened is we had as many people from not just the People Care subgroup, but also from the wider Care Innovators who were able to come down to the House of Lords and physically go to Parliament to launch it. That was kind of like I guess like the official stepping point. I don't feel like I'm describing it very well. Essentially, it was an amazing moment, and from there it's just built up so much momentum. We've had care associations and local authorities come back to us and say that they're going to start piloting some of the recommendations that we've recommended for local government. We've spoken to Damien Green, who's the chairman of the Adult Social Care APPG, which is a cross-parliamentary group, and they've agreed to include as part of the written evidence into the current 6-month inquiry slash consultation that they are doing into adult social care. We have been sending it out to MPs. We have been sending it out on social media. We've tried to get it picked up by the media. Anyone and everyone who we can get it out to, we've been trying to do so. And what's been really lovely to see is that it is building momentum. So we were asked, some of the people from the People Plan subgroup, we were asked to be panelists at the Healthcare Plus show in May, and then the care show, not the care show, the one in Birmingham in July. And the first one in May, I don't think too many people had heard about us, but by July, by the time July rolled around, we had some people come up to us to say that one of the main reasons that they had come to the care show was because they wanted to see, they wanted to learn more about the people plan. They wanted to see either how they could get involved or how they could start implementing some of those recommendations in their individual organisations. And what was really lovely is, so like I mentioned, Adam Bernal, he's one of the people who's already involved in it, and apparently he's become quite a bit of a celebrity. So we had someone who came up to us and asked him for his autograph because she works in, I think it's a health and social care course or degree. She's one of the people who teach there, and she said that her students think of him as a bit of a celebrity and they wanted her to get his autograph. So it's just really, really lovely. And, some of the changes that are being made is that various organisations across the sector, whether they represent care homes, whether they represent domiciliary care, whether they represent individual care workers, care professionals, all of them are endorsing the people plan, because we try to get as many voices from as many different parts of the sector involved. And like I said, whether that's someone who is working as a personal assistant or someone who is in a care home, someone who's living in a care home or working in a care home, we wanted to get as many voices involved. And it's really lovely to see that we've got so many endorsements. And one of them is from Ed Pauls, who obviously used to be a former Health and Social Care Secretary. He did his documentary about the social care crisis last year, so 2021, and then he was interviewed by Adam earlier this year in July. And it's just really great to see how so many people are able to get involved. And I think one of the greatest things that Ed said within that interview is that it's not a case of having him or someone else be the face of social care. The face of social care is and should be everyone who's already in it. So whether you're working for someone in social care, whether you are drawing on care yourself, whether you are advocating for someone who is using care, they are the face of social care, as they should be.
Yeah, and I think it's, if you speak to anybody, everybody knows somebody involved in social care. Everybody will know somebody
100%.
Involved in it, whether they work in it, whether they've got a family member in it, whether they've got, just everybody knows somebody, don't they? So it affects absolutely
100%.
Everybody. And there's not many things that affect absolutely everybody. So it's...
Yeah, everyone knows about the NHS, but the NHS is obviously an area that you normally only interact with if you've got an acute need or if you've got a clinical need, whereas social care, it's all about the community. Like you said, everyone knows someone. They might have a grandmother who is living with dementia. They might have someone, one of their colleagues is living with a learning disability, because also that's one of the things that we wanted to really emphasise within the people plan, is that there's a common misconception within the wider public that social care is just for people who are over the age of 65, when in reality, 35%, 40% of the sector is made up of working age adults. We wanted to make sure that their voices were being heard and that their needs were being supported as well. I've kind of lost my train of thought where I was going with all of this. So just a fun little story. After we launched the people plan at the House of Lords, I think I had to get an Uber somewhere, and I was talking to the Uber driver, and I mentioned about how the consultation is going to be open later in the year. We'd love to have as many people involved, and he started telling me about how his cousin is living with autism and his aunt is really struggling, and I was like this is my point. Everyone knows someone.
Yeah.
And until you start having those conversations, it's almost like it becomes this thing that no one talks about until they need to. But in reality, we should be talking about it. We should be open about it, because unless you talk about it, nothing's ever going to change.
Exactly. And I think, you mentioned about it being a misconception that it's just care homes, for example, for the elderly, and it's not.
Yeah.
And I think something like this definitely helps create that wider audience, creates that bigger perception, if you like, to kind of show people that actually there's so much more involved in this than I think a lot of people even realise.
Yeah, exactly. And we definitely, as a people plan group, we have tried to take on board as much feedback as possible. So we had last year when we created the report, There was also an easy read version, but one of the things that we were told is that the survey itself was not an easy read version for people who need an easy read. And so this year, when we've created the survey, we have the official survey, and then we also have an easy read version. And throughout both last year's consultation and this year's consultation, we've tried to make it, we tried to promote the accessibility as much as possible. So if an online survey isn't the way that you find it most convenient to share your views or your suggestions or your experiences, then let us know what works for you. If you want to have a video call, if you want to leave us a voice note, if you want to send us messages on social media, drop us an email. We are open to any and every form of medium possible.
And that comes back to, again, like you mentioned at the very beginning, you want as many voices as possible. You want as many different people as possible. And the way to do that is, I guess, to open it up. You know, you've just mentioned not everybody might be able to fill in a survey or whatever that might be. So even to that point, opening up how they can actually contribute towards this is a really key point.
Yeah, exactly. And we want to be very open about any feedback that we get. We try and learn from it, because we're all human at the end of the day. None of us have all of the answers to everything. We're not perfect. And if we have either missed out on something or we haven't given it enough emphasis, then if we know, then we can obviously improve for the next round.
Absolutely, yeah. Thanks again for joining us this week, and thank you to everybody for listening. We're back with Jasmeet next week for part 2 of the podcast. Don't forget to rate and subscribe wherever you get your podcasts. And if you have any questions for us or our guests, please email whatthehealthtech@radarhealthcare.com.